The purpose we are meeting this morning is for inauguration of our Advanced Trauma and ER Center. So on this note, what we found as we went in this journey is that we are getting a lot of patients with trauma and accidents. In fact, initially we had an emergency center, ICU, an emergency center which was catering to normal emergencies, patients coming with sudden heart attacks, GI bleeds, coma and so on, and we're treating them. But suddenly we realized that there was a huge number of patients coming with trauma. Some of them with simple trauma like falling down in the house, breaking their arm. Some of them with polytrauma. And lately the polytrauma has increased because of course I think you have this large ORRs in Hyderabad. You have advantage of these very nice roads and all, but that also brings with it this problems of potential road trauma, polytrauma. So we started getting a lot of patients who came with polytrauma, and we realized that because we have a group of doctors who are extremely well trained in this type of area, many of them trained abroad, that we should set up this center for polytrauma and advanced emergency care. With this in view, we started set up this center, which is inaugurated very kindly by Mr. Stephen Ravindra, and this center is a complete self-sustained center which is acting 24 hours a day, manned by a very eminent team of intensivists, trauma specialists, orthopedicians, neurosurgeons, neurologists, interventional radiologists, plastic surgeons, gastrointestinal surgeons and so on. So it's going to be probably one of the best well-manned area in our country in emergency trauma area.
As far as Cyberabad is concerned, we report one of the highest fatalities and road accidents in the entire state. In fact, we are in the process of trying to figure out how we should deal with this issue. Certain things that I have learned from my visit in Tamil Nadu was, specific 108 ambulances were assigned certain hotspots, and they were given even an app which will actually give them specific navigation and directions to the hotspot. So within no time the ambulance would reach them. Of course, coming to police, I should say our DCP traffic is here. You must be aware that we book the highest number of cases, enforcement cases, be it drunken driving or I should say overspeeding or triple riding or overloading or whatever. So as far as enforcement is concerned, Cyberabad is on the top as far as the state is concerned with regard to enforcement. But again, unless all these departments, all of us come together, confabulate and partner and evolve a solution which is real time, I don't think we can bring this fatalities down.
At AIG Hospitals, we like to review the feedback given to us from time to time. And one such was on the ER response side. So when we started looking into the data, we realized that there are conditions in which our clinicians and team has got a few days to respond. Some have few hours to respond, but there are definitely a few which only allow us a handful of minutes to respond. And that was when the genesis of a dedicated trauma unit came into being, and today it's turning into a reality. We have round-the-clock team of specialists manning this center. We also have developed the workflows to align it in such a way that the patient gets the fastest response. During the later part of the day, we'd love to show you around the facility, which has a CT scan, an operating room, and an ICU co-located in one place, making sure that we are able to give the fastest response to any patient which has trauma. And by means of trauma, it means that we can respond to even simple cuts, bruises, fractures, to the most complicated, complex, multi-organ trauma from a road accident we can handle it all in one place.
Spinal fractures, these happen again even at home, simple fall from height, particularly in the elderly, or they can be associated in road traffic accidents or fall from height. The most important thing in spinal injuries is affection to the spinal cord. If the cord is affected, there's a significant injury and it can cause a lot of morbidity to the patient with loss of function in the limbs because they go into paralysis, and some of them can be long-term morbidity. So any person who had an injury to the spine, the first thing we need to do is immobilize them. Don't move the neck or the rest of the body, and try to keep the patient as a log, and then gradually the patient has to be shifted safely to the nearest hospital. So spinal injuries, one thing you need to remember is, if a person has a spinal injury and you suspect it is a major injury, please immobilize the person, don't let them move, and then get them into a hospital safely. Whiplash injuries, like when you are going in a car and in our road with the traffic, suddenly you may need to put up a brake, and that's where you get your head going forward and backward. That can cause whiplash injuries. Most of these can be treated at home and with rest, and probably as an outpatient seeing a specialist in neck injuries.
The topic which I am going to talk today is the first aid measures for road accidents and trauma victims. This is just a video demonstration. At the site of injury, first be careful. Before protecting others, protect yourself, because sometimes these injuries may cause the seepage of the fuel and explosions can happen. So be careful about that. Wear the proper gear, reach the site, inspect the surroundings. First try to identify the patient's consciousness, his level of consciousness, whether he is conscious or unconscious. Here we can see, without stabilizing the cervical spine, the neck, we are not supposed to tilt the patient. So this is the correct way how we are supposed to turn the patient at the site. And next step is lifting, and while lifting, ensure that his neck is supported. Don't just try to pull him with his arms. So this is the way. Try to stabilize his neck and shift him to a place outside the, near to the where he can get good aeration, and inform the police, inform the ambulance, and if you find any Aadhaar card of the patient or any identity, inform the relatives. Don't be panic. And once there might be some bleeding sites, so take a napkin or a clean kerchief and try to compress it and put it for some time, so that till such time the ambulance or emergency medical services arise.
Further to what my colleagues talked about on two topics, I will emphasize more on the basic aspects of what is first aid. And it's true for medical emergency or any other emergency that management must begin much before the point of occurrence. So the preparation is the key here if you have to manage any kind of a medical emergency. And my other colleagues have commented on this. What's first aid? It's an immediate treatment or care given to a person suffering from an injury or illness. That's only till you get more professional help available, or till the person luckily recovers from the injury or illness. And these are the 3 P's, or the basic aims of any first aid you need to be aware of as a first aid provider. Your main emphasis is on preserving life, preventing any further harm, and at the same time promoting any recovery. The role of first aider, you should be able to recognize an emergency. You should be able to protect yourself, the bystander, and the injured or ill person. At the same time, you should be able to access help. This is in the form of calling for an emergency medical service. Even the simple act of picking up a phone and calling a medical emergency is also a part of first aid. If you don't know anything further, even if you have done that small bit, you have served as a good first aid provider. Remember that. And you should act according to your skills, knowledge, and your comfort level.
Under the leadership and guidance of our Honorable Chairman, Shri Mahesh Bhagwat Ji, the Commissioner of Police, Rajkunda Commissionerate, we at RKSC drive initiatives with utmost dedication and passion. The Forum Joint Secretaries, Office Bearers and volunteers from member companies and our partners from various self-help groups and NGOs ensure that no stone is left unturned to make the eastern corridor of Hyderabad a safe and secure environment for its people and propel growth in this region. So basically, with the Rachkonda Security Council, we have 5 main forums that we have planned and established. The forums being a women's forum, road safety forum, safety and security forum, cyber security forum, and social outreach forum. So these are the main 5 forums that work under the RKSC.
We are 54 marshals working on the fields of Rachkonda, the biggest area in size of kilometers, but 54 people are like 5,400 for us. We have worked 365 days during the COVID. You would have seen us on the roads helping people at every given time, at every given moment. We are there with slogans on the roads. We have got placards with people. All our marshals, they seriously give proper time. We are not very huge in numbers, but whatever we are, 1 is 100 for us. And thank you very much all the doctors for giving us lovely training. As requested by one of the gentlemen, we will also request you to kindly pass on these presentations to us so that we have an in-house training for our own marshals, and when the numbers are increased, we keep them training. And I will be very happy to inform you that 6 of our marshals are properly trained for CPR, and they have done 2 live CPRs. May I request Amit Virwani to kindly stand up, who has done a live CPR on the road. Thank you very much for giving this opportunity to us. Long live RKSC. Thank you.
First of all, I would like to congratulate AIG for setting up such a phenomenal center in Hyderabad, where every Hyderabadi is proud of it. I remember just a couple of days back, I was traveling in train, and the person sitting next to me told me that he had come to Hyderabad in the morning and going back in the evening, and he had some problem related to stomach. I very curiously asked him, because I kind of was expecting the answer to be AIG, and I asked him about where was he coming from, and what kind of treatment he got, and what is his experience. And I'm extremely proud to say he was coming from a very small town in Madhya Pradesh. He came all the way, completed all his procedures very professionally in a day, and went back. It is not very easy to get this kind of feedback and experience sharing from a patient, because usually they will have something or other. They said, okay, the billing was not right, the doctor was not talking to me properly, or the post-consultative experience was not great. Something or other like this people will mention, because the expectations are very high. Especially when somebody is in trouble, they expect a lot of care to be given to them. And I'm extremely proud to say that we have such an institution in Hyderabad where people all over India, coming from any strata of society, can depend on this institution to get the best of care and procedures. Thank you, AIG. My heartfelt gratitude.
The last 2 years, we've been interacting with AIG, with doing a lot of programs like interactive sessions with ITS employees, webinars. You know that last 2 years how we have suffered. Everybody was relying on the medical industry, and there are success stories. I can say there are many success stories. I think Madam was telling a couple of stories of how the trustworthiness, and when we walk into AIG, I think it's my personal experience within my employees. When we keep interacting, I think they say that there are many hospitals, as like Madam said, they come and ask us, do you know somebody from AIG? I think that's the way the people question us. I said, can you help me out? I think the typical calls are typical, say that, can you speak to someone and help us? I think this is offline, but as a corporate says that we have utmost trust on AIG systems, because the procedures in place and the quality of work, the doctors, the complete staff, from your senior management to the complete administrative staff, what I say, I think it's a collective team effort. I think you do a tremendous job. I think that's what today the industry talks about you. I think this is one testimony which I can tell you. You guys are doing a fabulous job, and the complete industry trusts you, and then it's something which is a great credibility for the organization.
Dr. Nageshwar Reddy garu, congratulations to you for bringing up this advanced trauma center here today. Very much required, I think, as CP sir just explained, and glad to be part of this whole program here. And as we were discussing there in the trauma center, I think the healthcare infrastructure is improving by the day, and a lot of innovation has been happening in this particular industry. And I think already, I wouldn't say in future, we are already much better than any of the Western countries as we speak, and the time to response, right, in emergency care. I think we are excelling day by day, and this is one step forward in that journey. And coming to Society for Cyberbug Security Council, we work very closely with Cyberbug Police. This is an organization which was established 16 years ago. I mean, I was fortunate to be part of some of the events here at AIG Hospital as well. And Dr. Rajiv Menon is our Joint Secretary for the Healthcare Vertical in SCSC. In alignment to what CP sir just spoke about tie of Government of Telangana, a similar initiative was taken up here in Hyderabad by SCSC in collaboration with Cyberbug Police. That is called Savior. Savior is saving accident victims on road. So this is pretty much on a similar framework on the format. We do have the framework in place already. We will, due to COVID, I think it has taken a backseat in the last 1 year, one and a half year. But now with DCP Srinivas Rao Garu, we will be reinitiating that program once again, so that we bring about a platform, as CP sir has already said, that a team of officers will also be allocated to take this initiative forward.
Good morning, everybody. On behalf of the faculty, staff of AIG Hospitals, a sincere thanks to all the people who have joined us in the inauguration of this Advanced Trauma Center at AIG Hospitals. As Dr. Reddy has told you, it is going to be one of its kind in the country and in the world. And I think the work of the consultant will speak volumes of what is going to happen in future. Now, this Dr. Reddy has told you about the team that we have formed at AIG. Basically, it's a team of clinical, paraclinical staff people. We not only give the best possible support to the victims of this trauma, but we assure you that we'll give you the best possible support system to the families. We know how much of trauma that the people go through. The physical trauma is what the victim goes through, but the mental trauma is what the patient's families go through. We are also making sure that we have adequate facilities here to counsel these patients on the emotional note on the family side, so that both the things are taken care of very well. So a combination of the clinical care plus also the family support care that we are going to deliver would be a totally different care that we are going to deliver from AIG side to the victims who come to the hospital.